I'm Dr. Abhishita, internal medicine physician, and I'll be talking to you today about symptoms that are commonly found in a COVID 19 infection. Firstly, post exposure to the virus, we usually develop symptoms 2 to 14 days later. And these can range from onset of fever, which can be low grade, like a 99 to 100 degrees Fahrenheit, to a high grade fever of about 101 to 104 degrees Fahrenheit. Secondly, we can also have throat pain, throat irritation with difficulty swallowing, a cold, a cough that can initially be a dry cough and which can then go on to develop into a wet, productive cough with production of copious amounts of sputum. A lot of people also complain of profound weakness, body pains, backache. Some very rare symptoms that can be encountered can also be rash, conjunctivitis. Uncommon symptoms can be new onset of loss of smell or loss of taste, abdominal pain, nausea, vomiting, or loose motions. The pediatric age group patients can have similar symptoms, but we always have to be on the lookout for children for very high grade fever, lethargy or tiredness, sleeping for long hours, dry, cracked lips, just like signs of dehydration, and these are important signs to look out for. Another very important point here is children usually develop gastrointestinal symptoms, which can be abdominal pain, nausea, vomiting, or loose motions. Second, when do you reach out for medical help? So of course, if you get a fever, sore throat, cough, body pains, or just sudden onset of weakness which lasts more than 24 hours, please seek medical advice about the next steps. And when do you get tested? Like, so you've had fever, you've had cough or sore throat. So when do you go ahead and get tested? So as soon as you develop symptoms would be the best time to go and get tested. If you have a COVID-19 infection, which can be a rapid antigen test or an RT-PCR test. Important here are what are the symptoms that kind of signal, say, a critical or a severe infection, what we would call red flag signs. One, of course, which everyone is aware of, is breathlessness, where you're seeming to run out of breath on exertion, say on walking or talking on the phone, or you're just breathless at rest. If you're monitoring your oxygen levels at home, saturations of below 94%, you should contact your nearest healthcare provider. High-grade fever not responding to paracetamol or any NSAIDs or anti-inflammatories can also be a sign of a severe infection. A persistent cough, which can cause, say, difficulty in speaking or a sense of breathlessness, can also be a sign that you need to maybe think about a severe infection at the early onset. The most important thing that we all should remember at this point is, for a COVID-19 infection to develop symptoms, he of course needs to be exposed to the virus. So the best way out of this is to always wear a face mask, maintain social distancing, follow all cough hygiene protocols which are there, wash your hands frequently, and this will ensure that the caseload is less and fewer people get infected by this virus. Thank you.